Charlie. I recall being in your clinic in the late 40s, really, and you were really in one sense a difficult teacher because you demanded so much of us. But on the other hand, every afternoon somehow you managed to calm us down with tea at 4 o'clock. And I remember that it was during this period in the late 30s that you began to talk about cancer. And tell me how how did you get started in the cancer field?
All of my investigations and studies have been interconnected as the rungs on a ladder. And I was profoundly influenced, as we all must be, by the spirit of the times. If we draw from the zeitgeist, and if our work has impact, we contribute to the spirit of the times. The second quarter of our century was dominated by three things. One, discovery of the steroid hormones. Second, phosphorus metabolism, with the wonderful studies of ATP and pyridine nucleotides and so many other phosphorus compounds. And the third was the vitamins. We entered cancer work through a logical procedure. I was studying in the clinic prostatic hypertrophy, which is a terrible disease of elderly gentlemen. It seems that prostate cancer and prostate hypertrophy are two of the most serious afflictions of elderly men. And time after time, a gentleman would say, what is the function of the prostate gland? And at first I would say, it's very complicated. Don't be concerned about this. You're ill and you will be well. But soon I thought, no one knows anything about prostatic function, so we devised a simple physiological device for the collection of prostatic fluid of dogs. And we studied this for some years, and many of the urologists of the United States were trained from the operative standpoint by doing this procedure of collecting and analyzing the prostatic fluid. Now, in all great investigations, and I don't claim that this was great, there is an element of luck. Our work was done on the dog. Only 3 species have enlargements and cancers of the prostate in old age. They are man, dog, and the lion.
Did you ever work on the lion?
For obvious reasons, the lion studies were omitted. But in studying the physiology of dog prostate, inevitably we came on these large prostate glands the size of a grapefruit. And at first we were vexed to find a tumor of the prostate where in a study designed to be physiologic. But after encountering 3 or 4, and it occurs always in all old male dogs, and after encountering several of these conditions, we decided we'd make a study of cancer and hypertrophy of the prostate of the dog. And we found it was very simple to make the thing heal. Namely, orchiectomy would cause the tumor to regress. And then testosterone would restore the disease, not to normal, but to the original disease. And third, estrogens would cause regression of the tumor in a dramatic way. So we had control over a tumor of a dog. We could make it grow or regress as we please. We could do it by surgical means or medical means.
Is the, you know, in the days when you were actually removing the gonads in the male, I remember that I used to, as a student, I used to worry about this a little bit as to what this would do to the individual. It's true that most of them were elderly people. How long was it after you started with that procedure for the control of hypertrophy as well as the cancer of the prostate, that you began to use the estrogen as a replacement?
To get into human prostate cancer, we had to be on very firm ground with dog, and we were certain of the physiology, physiological procedures. But medical research, 1940, as it is subsequently, is biochemistry, biophysics, the application of physiology and chemistry to disease processes. We found that the methods we had for causing dog prostate to shrink applied to man. But then the proof, that was done by a study of acid and alkaline phosphatase in the serum of human beings. So we were absolutely certain. The determination of acid and alkaline phosphatase in the serum of man is, with prostate cancer, is as significant as measuring the temperature of a person with infectious disease. It gives a clue to what is going on in the cancer. So these were novel things. We deliberately sought out gentlemen with prostate cancer and brought them for clinical investigation. One of the most subtle and the most difficult and wearing of the branches of medicine to engage in clinical investigation. This gave rise to the concept of physiology in the control of cancer of human beings. It would appear that every medicine...
It's often said that publicly by many people that you were the first one to introduce chemotherapy, in quotes, into the treatment of cancer. And I suppose, with the exception of the such things as arsenic and related Fowler solution for leukemia, it probably was the first approach to chemotherapy of cancer in man.
The effects of hormones on prostate cancer, hormonal modification, were, if I may say so, dramatic. One could and can do the following. A gentleman with far advanced cancer will come in the clinic. You say to him, sir, all you have is far advanced cancer of the prostate. Take this prescription, have it filled. It'll cost you 25 or 35 cents. Come back in 2 weeks and you may be better. And the patient comes back 4 times out of 5. He said, thanks to Almighty God, I am better. I feel well.
Right. Well, you know, I have to go back in history just a little bit because since I'm on the program talking to you here, I have to tell you that you did a piece of work back in the 30s which had a profound effect on me, and that was that you showed that if you inserted the rat tail into the tummy of the rat so that the tail warmed up, it began to make blood. So this to me had suggested to me that one could actually influence blood formation. The AMA in the 30s for that beautiful work on bone marrow. So I just don't want to pass over this particular item. Now then, this introduction of the effect of the hormones, the male and sex hormones on cancer, and in particular the cancer of the prostate, of course, opened up an enormous area of interest and investigation, which still goes on because of the importance of hormones. But it wasn't long after you had been involved with this particular area that you got into the problem of cancer of the breast, and I'd like to hear a little something about that.
My research activities have been the following. They've been dominated by total commitment. If one gives all he has to the problem, something can be done. If you want to work a 5-day week, forget it. The young man might as well go into another line. Total commitment is not enough. You need a little good luck, but without total commitment, nothing can be done. The second characteristic of my work is it's been very much like a hummingbird, flit from a beautiful, promising project from one to another, tackle many things, finish none, take a little nectar from each and every one. Being devoid of stamina, we work assiduously on human prostate cancer, but 12 years was all I could take. We worked from 1939 to 1951. Then I thought, let's take on another the cancers of man. Let's take on the most serious one, namely cancer of the breast. In doing so, we took on human female. Before that, I knew nothing about the human female, despite having had one mother, one wife, and one daughter. But to change the sex of the patients, now work exclusively with female, that was a fascinating and interesting thing to do, too. We found that cancer, it had been known that cancer flourishes in many women after the menopause. It also flourishes in women who have had ovaries removed. So why was this? It came upon us that the adrenal function was maintaining mammary cancer in human beings. So with the aid of young people, and there were young people in all of my work, with the aid of assistance of a young endocrinologist named Del Bergenstahl, we devised a method to remove adrenal glands from people, and certainly in some of the cases there was profound regression. So we were able to contribute to the welfare of the mother of the race, who holds the family together. We were able to give something. The woman with breast cancer comes in the clinic, and the patient husband, white as a sheet, says, don't tell her. You mustn't tell her she has cancer. She knows. All of the women know they have it. They have the feeling they have cancer. To do something for the mother of the race was enormously gratifying to us.
You know, I want to ask you about, well, going back again to some of the work that you did in the 30s. You began to have young people in your laboratory, and it seems that you've continued to do this ever since the 30s. I don't think we should go through them all and name them, but it seems that you have produced some of the great men of the last several decades.
Well, I've been particularly blessed by having wonderful young men and women work with me, and selection of the personnel is the most subtle of the arts. So I gave up. I didn't select people. They selected me, and they came in. All they got from me was a classical education. They learned biochemistry and morals, industry, total commitment, and we talked about everything with two exceptions. There was no conversation about sports and nothing about politics, but anything about art or science was fair game.
Well, you have a remarkable record in terms of the people who are in various institutions throughout the world who were in your laboratory. One of the other questions has always interested me has to do with were there any civilians who had any profound effect on you and your work?
Of course, family did.
Yeah.
Without family supporting the medical investigator, the investigator in science, nothing could be done. The bachelor in science is enormously handicapped. It can be done, but it's wonderful to have enthusiastic, warm support of wife and children.
Well, of course, I was thinking of some of the industrial people, industrial giants in the United States who have been interested in your work and have, in fact, supported some of it.
I've been particularly fortunate to be adopted by two people. The first one was Mrs. Albert D. Lasker. It came about in 1943. Mrs. Lasker said, what's your operating budget? And answer, $3,000. This comes from National Research Council. Each and every dollar spent was thought about again and again. And she said, you better expand. So she said, I will give you $10,000 a year for 3 years. So we took this and expanded our work somewhat. And I was so fortunate to get a young man associated with me, now Professor A.L. Leninger,
yes,
from Hopkins. He and I talked continuously every day for 8 years. We never collaborated on a paper. It was enormously useful to me to have a keen young man, and I hope it helped him to get some idea of how doctors go at biochemistry.
As a matter of fact, Leninger is at Hopkins, and so, of course, is W.W. Scott and Cal. They all of them worked in your laboratory at one time. You know, I suppose one is always asked this question, but it would be a very difficult one, really, to answer. Last night, I think, when I was talking to you about, in general, you said to me, who do you think are the greatest, who's the greatest man you ever knew? And what I'm going to ask you now is, as you think over your work, what do you think is the most important thing you ever did? In science now.
It's so difficult to tell. The most important thing I did was to get away from supervision from other research workers and to sink or swim. I want to do my best to elaborate my own theories, and if I sank, that'd be too bad, but anyway, I would go to hell in my own way, and that's what I wanted to do, so that was the big thing. Now, 1951, a wonderful thing happened to me. We developed a patron by the name of Mr. Ben May, a successful Southern lumberman who has contributed magnificently to the support of our work, leading to a research institute at the University of Chicago, which is called Ben May Laboratory for Cancer Research. Here, there are enormous a number of talented young men, not only American men, but from 5 continents have come, from Asia and Europe and all of these places. They come and spend some time, and then they return home. They metastasize. They take with them, though, the spirit of the Ben May Laboratory, the spirit of total commitment, the spirit that science is wonderful. It's a privilege to do it. Pay no attention to income. If you can get a living wage, this is all that's needed.
Well, Charlie, you didn't answer my question. You're trying to going all around it now. Maybe you don't want to answer the question.
It was the most powerful work I know was that of Otto Warburg.
No, I'm talking about your work.
Well, I'd rather talk about other people.
All right, okay, Charlie. But at any rate, so with all of these wonderful things that came out of your laboratory, and we shall not then try to categorize them in terms of which is the most important, because they're all of great significance. But at any rate, one day in 1966, I remember you had a guest from Stockholm whom you took out to your country place. And it was a cold day in December. Would you like to tell me about that?
Well,
Was it November, I guess?
yeah, this was 12th of October that we had an international conference on tumor host relationships, the control of cancer by physiological modifications. And after the two-day conference, we went to our small place in the country to entertain our distinguished guests, one of whom being a Swedish man, Gunnar Berke.
Right. Well, but, the story I heard later, Charlie, was, which I think is really classic, was that Charlie did not know that he was going to be given the Nobel Prize, but this particular man who was here and on the program, Charlie's program in Chicago, did know, and Charlie wanted him to go swimming in Lake Michigan in October. And the man was really concerned that something might happen to Charlie, knowing that Charlie was going to win the Nobel Prize in a month or two. Now, you did actually take him swimming?
No, he wouldn't go. He said to me, Charlie, please don't get drowned today. And I said, well, I promise you I won't get drowned today. Not the best day in the world to get drowned. Because the next day we heard pleasant news over the telephone at 5 minutes after 7 in the morning.
Well, at any rate, you were told that morning that you had won the Nobel Prize, and I do want to hear a little more about it, although the fact is, of course, that you and Margaret asked Betty and I to accompany you to Stockholm. I'm often wondering in retrospect, was it whether you liked us or whether just because you thought I could speak the language?
Well, it's so difficult. When one goes to Stockholm, it's a pleasant occasion. It's like having 10 weddings in the family, all at one time. This is a time of happiness, and one wants his family there, dearest friends there, so that it was a great privilege for me to sit down at 1 minute and write out a check for travel expenses, a check for $5,000. This was at the expense of the Nobel Foundation.
Well, it was a great occasion, and of course, you shared that Nobel Prize with...
It was Peyton Rouse, one of the great men of the age. Peyton Rouse's business was finding out. I use the word discovery because I'm delirious and ecstatic whenever we can discover even a little thing this big. Peyton Rouse thought discovery was pompous, and with him it was finding out. The business of finding out is one of the supreme joys of mankind.
Now then, after all of these, well, you know, I could go on ask you about the various prizes you've won. The Lasker Award, Gertner Award, Catherine Judd Award, etc., all of which are very important. Now, on the other hand, I would like to ask you about what do you think about medical education today and about science today? Where are we going?
Well, science is immutable. It seems to me that the rules for discovery have been set down. There is no shortcut. There are improved instruments which are useful but not essential. The most essential thing is the use of a rare instrument called human brain. If one will use logical principles plus time plus commitment, then discoveries are inevitable. Where are we going today? With the population explosion, there's a great tendency for shortcuts. There is this great demand for, quote, social commitment to the community. The best thing that can be done to alleviate, to benefit the health of the masses, the socially disadvantaged, is scientific discovery. It's been the same as always. Scientific research in the universities, in the medical schools, must be fostered at all costs. And any time spent in trivial matters like discussion of community needs is time wasted.
Well, you know, it's been just a wonderful experience to listen to you develop your whole career, and I must say that if we could all have the same philosophy in terms of medicine, care of patients, and in pursuing science, we might even be farther along than we are. Although in these past 2 decades, of course, with your help, we've moved farther than in the whole history of the world.